for our senior Australians.
Thank the member and give the call to the member for Dunkley.
Thank you, Deputy Speaker. My first question to the Minister for Health is, will the Minister urgently look to reform the distribution priority area system to allow bulk billing GP clinics like those in Carrum Downs and Frankston in my electorate to be able to recruit doctors to service the people in my electorate? The Minister would be aware that I have raised in this parliament and written to him about 4 different GP clinics in my electorate. Dr Ravi Ravuri from the Bayside My Health Clinic has said to me that the DPA classification needs to change because he cannot attract doctors to his area. I have written to the Minister recently and outlined the situation where the only female doctor working in that clinic had difficulties finalising her exams as part of her SAPP placement, significantly due to COVID. She can no longer work at that clinic. Dr Ravuri cannot recruit a female GP to that clinic in the Bayside Mall, which the Minister, coming from my area, would be aware of is an enormous shopping centre which has something like 400,000 people that go through it a week, extraordinarily, and that is the bulk billing clinic in the centre. And Dr Ravuri's concern is there is now no one specifically to deal with mental health issues of people who attend that mall, and it has been a very, very successful model where the Dr Naziri, who can now no longer work there, has been responsible for that mental health. If it can't be resolved that Dr Naziri is able to get her medical practicing certificate, as Dr Ravuri says, it's the DPA classification which does not set Dunkley as an outer metropolitan area as a priority area, which is preventing him from recruiting doctors. The other, 2 of the other medical clinics that I've raised previously and have written to the Minister about are part of a group of medical clinics, and they are specifically the Bellato Medical Centre on Bellato Road in Carrum Downs and St Mary's Medical Centre, which is on Frankston Dandenong Road in Carrum Downs. It is becoming a desperate situation for these 2 medical clinics, which provide bulk billing services to some of the most socio-economically depressed areas of my electorate. It means that the medical clinics are struggling to function, but as the Minister would be well aware, it also means that members of my community can't access healthcare when they need it. Very recently, Rachel Hatzopoulos, who's the Group Operations Manager for these 2 clinics, wrote to me again, and she says, and I quote, "I wanted to touch base with you both again, myself and my electorate officer Lauren, to see if there is anything that can be done to try to help us. The Department of Health have made it impossible to recruit doctors to a bulk billing clinic in a metro location. We have struggled so much with St Mary Medical Centre especially. We open until 10 p.m. and all weekends and public holidays and rely on 1 doctor for after hours. Our 3 other GPs at St Mary are so heavily booked with patients and cannot do any more than they are doing. Our patient demand is far greater than our capacity. We are turning patients away daily and often after hours have to direct them to emergency when they could easily be handled in primary care. It is so ironic, given the television commercials I am seeing that say, don't call 000 or go to emergency, see your local GP. It's a very big contradiction. A few weeks ago, it was quite upsetting that someone put a post in one of the local community notice board pages about how bad our waiting times are. We do take appointments, but patients also know if they are unwell, they can walk in when needed. There were a subsequent 60-odd comments of complaints about how we should just, quote, get more doctors, along with many other comments. We have done so much to try to get more doctors to offer more appointments to patients without any success. We have many doctors that contact us wanting to work, but the Department of Health and immigration restrictions make it impossible. I am just reaching out with the hopes you may be able to help us." And as I said, my question to the Minister for Health is, will you urgently review the entire system, but specifically these medical clinics and the issues in the electorate of Dunkley, where healthcare, affordable, universal healthcare is under threat because GP clinics, that bulk bill, cannot get doctors to service some of the most vulnerable members of my community.